Next, we'll be joined by Anita Savic. Anita Savic is a clinical and counselling psychologist with extensive experience as a clinician, as well as in training development and delivery, consultation, policy and practice development, management and strategic planning. She has led the development of organisational mental health strategies and large workplace projects. She has expertise in the mental health and well-being of high-risk populations, including 10 years' experience working within the police and emergency services sector. Her clinical experience includes delivering evidence-based mental health interventions to those impacted by trauma. Anita is an experienced trainer, developing and facilitating training on a range of topics, including resilience, mental health training for managers, and trauma response and recovery. At Phoenix Australia, Anita works across service development and training projects that focus on translating evidence into practice and improving capacity to manage the impact of traumatic events.
Hi, I'm Anita from Phoenix, Australia. Thanks for having me today. It's a real pleasure to be joining you for this session. Today we'll be looking at trauma and mental health in the workplace, how to support yourself and others. Phoenix Australia is a not-for-profit organisation. We're affiliated with the University of Melbourne, and our area of expertise is post-traumatic mental health. We support individuals, organisations and communities who have experienced trauma. We do that through research, policy and service development and training delivery. During the first part of today's session, we're going to look at what trauma is. What does trauma and stress look like? What are the experiences people might have following exposure to a traumatic event? And what does COVID-19 related stress look like? The second half of the presentation, we're going to focus on looking after yourself and others. We'll have a look at resilience and the importance of looking after ourselves during this time. And we'll look at psychological first aid strategies for supporting people during COVID-19. And we'll finish today's session with the important topic of self-care and looking after yourselves as leaders during these critical times. What is trauma and how does trauma and stress impact on us? A potentially traumatic event is any event in which the person experienced or witnessed a situation that involved threat of death or serious injury, either to yourself or others. This event can be sudden and unexpected, and some of the experiences or events that we might consider out of the ordinary include things like assault, rape, motor vehicle accidents, and in this current climate, they include natural disasters and COVID-19. Within your workplace environment, these things might include drownings or attending to young children. Potentially traumatic events can be single or isolated events, or they can be chronic or prolonged events. And many have described COVID-19 as a potentially traumatic event or a cumulative trauma event. The graph that we're currently looking at shows the individual differences that exist following exposure to potentially traumatic events. Not all of us react in the same way. Many people will react in a resilient way. So what we can see with that yellow line is that people using their usual coping strategies and good support will follow a resilient pathway. That is, their functioning will not be impaired and they will continue to function in a positive manner. Many other people will follow a recovery pathway. They may have a short-term reaction to this event, and then this period will be followed by recovery. Some people have what we call a delayed reaction. That is, following their exposure, they continue to function really well. We may not see any changes to the individual in the workplace, for instance, but following a period of time, and this may be weeks, months, or for some even years, we see a decline in their functioning. And this experience can be quite confusing for the individual as it appears to come out of nowhere. For this reason, it is really critical that for us as leaders and managers, we do monitor people on an ongoing way in case they do experience a delayed reaction. For a small but significant minority of people, they do experience persistent issues or problems following exposure to a potentially traumatic event. The key thing to remember is that this is a minority of people. For these people, they may develop a condition such as post-traumatic stress disorder, depression, or anxiety. When people experience stress or trauma reactions, we tend to see changes across 4 domains. They do vary in type and intensity between individuals. We tend to see changes to our thinking or cognitions. We see changes in our emotions, behaviours, and in our physical symptoms. So some examples of reactions that we might see in ourselves, our loved ones, or in people at work include, particularly at this time, we might see people experiencing fear, anxiety, sadness, or anger, for instance. Some common physical reactions tend to be changes in sleep, jumpiness. We might also see behavioural changes. Within the workplace or team environment, the behavioural changes tend to be the things we notice first. So looking out for these changes to behaviour is important. People tend to also experience changes to their thinking. They might worry a lot more, their concentration tends to go, or they might have trouble making decisions. So what we do tend to see is that during these periods of high stress, we do see an impact on social and occupational functioning. So some common mental health and behavioural problems following exposure to traumatic events, and this is across all ages, includes sleep problems and nightmares, hypervigilance, which means that we might experience some jumpiness or being on the lookout, depression, anxiety, and some somatic complaints, so physical complaints. The mental health spectrum is another helpful way to help us understand mental health. And it also helps us identify problems or stress signs early on. And this is really critical to good self-care. We can see that mental health is at one end of the spectrum. It's represented by feeling good and functioning well, while mental health conditions or mental illness is at the other end of the spectrum. And this is represented by symptoms that affect people's thoughts, feelings, or behaviour, and also represents mental health conditions such as depression, anxiety, and PTSD. Different strategies are recommended depending on where you are at the spectrum. When we are feeling stressed, we want to identify symptoms early. It's in this yellow area that we want to take note. Symptoms such as irritability, nervousness, forgetfulness, or those early stages when we might start to decline social offerings or social engagements with friends, or start to feel a bit tired or sluggish. This is the time when we really need to intervene early, and these are the symptoms that we want to look out for in ourselves, our family, but also amongst the people in our teams. There is movement in both directions along the continuum, much like a physical injury. If we intervene early and look after that injury early on, the return to full recovery should be much swifter and much quicker. Let's now have a look at some COVID-19 associated stressors and impacts. It's hard to ignore the current situation that we all find ourselves in Melbourne and Victoria. Looking at evidence from previous large-scale natural disasters and pandemics has been helpful to understand what some people might be going through. And there has been some early research done in the area of COVID-19 also. All of this research, past learnings and current learnings, tell us that during pandemics or in the aftermath of pandemics, there is a significant increase in anxiety, depression, and post-traumatic stress in some people. So it's really critical that we look after ourselves and each other during these times. Some of the potential stressors that have been acknowledged in the general community include having a diagnosis of COVID-19. So this may include diagnosis of ourselves or a family member, or knowing someone close to us who may have been diagnosed with COVID-19. We hear a lot about the personal stressors, and we're likely to have experienced these ourselves. We know that for people with pre-existing mental health and health issues, this has been a particularly difficult time and has made these people more vulnerable to the COVID-19 related stressors. The term coronaphobia refers to the mass fear of COVID-19. Restrictions, self-isolation and quarantine have all had an impact on people's mental health. And what we are hearing about is that they have also deferred people's help seeking for both mental health and health issues. In terms of the psychosocial impacts on our community, we know that prolonged restrictions lead to physical and mental health impacts. We have seen people talk about their frustration and boredom and pervasive anxiety, and loneliness has been a real issue for many. Aspecific or generalised and uncontrolled fears related to infection is another issue or impact we have seen. And people who have COVID-19 have shown varying degrees of stress disorders, even when they have returned to good health. We've also seen an increase in risk behaviours such as gambling and alcohol and other drug use. Let's have a look at the psychological impacts of restriction and isolation during this time. We know that increased levels of stress and psychological distress are evident both during and after an outbreak. And for some, these can be longer term impacts. The key thing to remember at this time, as we start to see some easing of restrictions, is that there is stress for many associated with getting back to a normal routine. For many people, they have experienced financial loss, they have experienced stress during this prolonged lockdown, and so there may be some anxiety about getting back to that normal routine and what that might mean. The Phoenix Australia website has further information on COVID-19 and its psychological impacts. To access these great resources, just click on the link in your chat function. In this half of the session, we'll have a look at the importance of good self-care and some general wellbeing strategies to support yourself and others during this challenging time. Resilience has been characterised or described as the ability to bounce back from adversities. Resilience refers to having the resources within the individual, their life or their environment, including their work environment, to facilitate this capacity to adapt to change or to bounce back following exposure to stress or trauma. Resilience focuses on the positive and on well-being rather than on illness. Building resilience is likely to help people cope better with exposure to stress or potentially traumatic events. So ensuring that we're feeling resilient and healthy and well as we enter challenging events or experiences is really important. Resilience is informed by the view that it can be developed and fostered. So resilience isn't something that you're either born with or not. It's something that we can develop and foster. And in this session, we'll focus on actively looking after ourselves and others as a core component of building our resilience. So resilience is not a permanent state. What this means is that we need to maintain our well-being. We need to stop that bucket from overflowing. It's a term that's often used in the emergency services and first responder sectors. Every time we experience a stressful event or we have a difficult experience, we fill that bucket. By using positive coping strategies and good self-care, we can empty that bucket to maintain our well-being so that it doesn't overflow. So resilience requires a proactive approach to self-care, regular practice of coping strategies, and ongoing monitoring of well-being. It's important to remember that one size doesn't fit all. So it's critical that we get to know ourselves, what our early stress signs are, how we're travelling, and what strategies work for us. From an individual perspective, there are a number of characteristics that can support our resilience. Making time for positive emotions is critical. Having a laugh at yourself, having a laugh with colleagues, or just having a good time at this particularly challenging time is something that can really contribute to boosting our resilience and well-being. Having the skills to manage strong emotions such as sadness or anger is also really critical. This means that when we are overwhelmed with strong emotions, we have the skills to manage those and that we won't act or react to those strong emotions. Adaptive, task-oriented coping style simply means having good coping strategies to manage problems. The opposite of adaptive, task-oriented coping would be to stick your head in the sand or to avoid dealing with your problems. Having a flexible thinking style means that we can adapt to situations. It's not about having all or nothing thinking, but being able to go with the flow and adapt to various situations. Finding meaning and having a sense of purpose is also critical. Some people find this in their work, others in their volunteer work, or in their hobbies and other interests. But having meaning and a sense of purpose is something that can really help boost our resilience. And of course, keeping fit, healthy, safe, and connected. And sometimes we can neglect this at times that we really need to do it. But eating well, staying fit and healthy is really critical. And this is something that you can not only focus on for yourself, but with the people in your teams to ensure that they continue to boost their resilience at this time. So some example of some good self-care strategies to promote for yourself and your teams include things like, in safe ways, spend time with people that they care about. Giving yourself and others the time to adjust and recover and transition during this time is also important. Learning about the impact of trauma can also be helpful for people. Keeping to routine and having structure and talking about feelings, but when the person or when you are ready is also very helpful. And basic good self-care, such as getting plenty of sleep, eating well, and getting good rest is also critical to good resilience. Resilience doesn't just apply at an individual level. We hear a lot about resilient teams and organisations these days. So what does that look like? The characteristics that contribute to a resilient team include having trust and confidence in your leadership, as well as having good organisational support. As leaders, we have a key role in establishing these characteristics. We know that team cohesion and good morale will also contribute to a resilient team and organisation. Having a positive team culture or a safe psychosocial climate is also critical to people feeling resilient at work. We talked about the importance of having meaning and having a sense of purpose at an individual level, but this is also critical at a team and organisational level. For many people, the work itself will give them meaning and purpose. We also know that support and communication and engagement with families is another really important characteristic to building team resilience. Let's now have a look at psychological first aid and how we can use PFA skills to support others during this COVID-19 period. It's important to remember that these are unprecedented times. So PFA and the skills that we're about to cover, it's not a silver bullet. However, providing a sense of safety at this time is critical, and meeting people's practical needs is fundamental to supporting people's coping and recovery at this time, particularly as we transition to returning back to work. So PFA is an evidence-informed approach. It's not a structured or standardised intervention. It focuses on the immediate and short-term period. However, the strategies that we're about to cover also apply to longer term and can be really effective, for instance, during anniversary periods or other stressful times. PFA uses simple, practical and flexible techniques that are tailored to the needs of the individual. In that regard, it is not a structured process. It assumes that individuals and people are resilient in the face of trauma, and it really promotes their natural recovery processes. So let's look at the first principle of PFA, and this is a really important one during this time specifically, promoting safety. There are a number of practical ways that we can help people feel safer at this time. Meeting people's practical safety needs through their working conditions, for instance, practicing good hygiene, following advice that we've been given, and providing information about resources. You might also like to check in with people and see what they need to feel safer at work. Some of the things that can help promote calm or ease some of these stressful or anxious feelings for people, for yourselves or your teams, are things like acknowledging the challenges of the situation. Providing information about common stressful reactions can also be helpful to people, and acknowledging that there may be stress associated with the easing of restrictions. Strategies such as breathing and relaxation, for example, are really helpful in helping calm people. As leaders, it's really important that we promote looking after ourselves and using these strategies. We know that because we know they're effective, and it's important that we lead by example. So some ways that we can promote or encourage self-efficacy. So using problem-solving strategies, for example, to assist people to prioritise and begin to address issues, reminding individuals about what's worked in the past, or helping to or supporting them to work out what's helpful to them, is a really good way to promote self-efficacy. As I mentioned earlier, promoting social support and connectedness is really important. It's the number one factor that supports recovery and good mental health. We heard early on during the COVID-19 pandemic, people talk about social distancing, but that was quickly changed to talk about physical distancing. We don't want to socially disconnect. In fact, we want to maintain those connections. As a leader, some ways that we can promote connectedness is ensuring that we check in with people and reach out to those who may be in need. Know what supports are available through Life Saving Victoria. Know what's available in the community for those members who might want to access community supports, and have this information at hand for those people. Given the critical importance of social support to recovery and good mental health, let's have a look at some additional and practical ways that we can offer social support to people, including emotional support. This is where we can have an empathic conversation with someone, provide them with information, for instance, and show our understanding of what they're going through. Practical support is another good way of providing social support. Do they need any practical support? Do they need any material goods or services, or practical links to other services? Some good ways to support people to feel safer and calmer is just to provide them with some information about common stress reactions or common trauma reactions. And of course, companionship support. So ensuring that we have people around us who we can have a laugh with, have a coffee with, and just hang out and do some social activities with is a really core important part at this time. Promoting hope is the final PFA principle, focusing on the positive and encouraging people to take control of what they can are ways that we can instill hope and assist recovery. As a leader, it might also mean that you can include activities for your team that are positive and that are hopeful. So in summary, we can use the 5 PFA principles to support our people at this time. Let's now move on to talk about how we can look after ourselves as leaders. As I mentioned, resilience is dynamic. This means it can change from day to day, and it also means that it requires constant monitoring and attention. It's a very proactive process. Now, as leaders, we also need to lead by example. COVID-19 has added another level of unique stress. To maintain your own well-being as a leader, it's important to actively monitor how you're travelling. A regular and quick check-in with yourself is important. So using a monitoring scale like the one that's up on your screen is one way we can check in with our mental health. Take the time to ask yourself how you're tracking at the moment. From a mental or thinking perspective, how are you feeling? Can you think clearly? Are you able to make good decisions? Or are you feeling a bit mentally worn out? And do the same with the other areas. How are you tracking from an emotional functioning perspective? Are you feeling strong and resilient, or are you feeling emotional at times? It's okay if you are. The key thing here is that you check in with yourself and monitor your own well-being and how you're tracking. And if you find that you're not tracking too well, it's important to implement some strategies to manage these. Another really important way to look after yourself is to monitor your early warning signs. We spoke earlier about the mental health spectrum and some of those early warning signs that are indicative of stress. It's really important to catch those early on. If you're not too sure what your early warning signs are, check in with someone either at home or at work, but someone that you trust to give you this information. Developing a self-care plan is crucial to maintaining our well-being and boosting our resilience. So if you think about the 4 areas we spoke about, mental, behavioural, physical, and emotional, think about how you're tracking across these 4 areas. Identify what your early warning signs are, and then what strategies you might use to manage some of those symptoms. It's really important to have additional strategies for times of high stress or for times of change such as these. By developing and implementing your self-care plan, you can look after yourself and maintain your resilience during the busy period. Now, we saw children return to school recently in Melbourne and across Victoria. And what I observed during that period is that teachers helped prepare children for the return to school prior to the return. We want to do the same. We want to prepare ourselves and our teams before we actually return to work. Now is the time to start preparing your teams. Share information, let them know how things are going to happen and what's going to happen, the way that teachers prepare their students. I wish you all the very best with your work, and don't forget, there are some great resources for you to access to support you in the work that you do. The Phoenix Australia website has a broad range of information, including tip sheets and videos about trauma, COVID-19, and coping strategies to support yourselves and your staff. Thank you for this wonderful opportunity to be a part of your day. I hope today's session has given you some insights and information that you can apply to support yourselves and your people as we transition back to work during this unprecedented time.